Hi, Dr. Robin Sykes here at Jupiter Plastic Surgery Center, and today we're having a Mother's Day discussion. And we have today Angela Manfredi from Legends Radio. I'm so excited that you're here.
Thank you for having me. I'm delighted to be here with you today and talking about things that I love to talk about. Confidence, getting more confidence.
Right. So Angela is on in the morning, Legends Radio, from 6 to 10, right? I listen to it all the time.
Thank you.
And she does really cool things. I love what she does with the red carpet especially.
Yeah, we do talk about, I spent 10 years in LA on the red carpet interviewing celebrities, seeing them in all their glamour. So that's something that I love to do. And at 8:35 every morning, we do a red carpet report. We talk about the latest celebrity news and a little bit of gossip too. So
yeah, I love it. It's great. So anyway, getting to what we're here talking about today. So Angela, you know, she talks about our office on the radio. Thank you very much.
Thank you.
And part of that comes from being a patient here herself. And so I wanted to actually ask her a couple of things, reasons that, well, why do you do what you do? Why do we do what we do? Why do we have plastic surgery? I think that's a really interesting topic, which we probably can answer for ourselves. You know, you look in the mirror, you say, well, you know, I could use a little help one way or other. Certainly, I have another birthday coming up. I feel the same way.
Next
So
week.
look in the
Happy
mirror.
birthday.
Why, thank you. You know, there's always little things that you can do to make yourself feel a little bit better, and I think that's why we function better, I think, because if you feel better and look better, then you're going to do a better job, I think. That's what I think.
It's confidence, and I like to share this story too, and I talk about it on the radio, is when I came to see Dr. Sykes, I said, where do we begin? You know, there was so much that I didn't know really where to start in my personal journey towards more self-confidence. And Dr. Sykes said to me, well, what bothers you? When you look in the mirror, what's an area that you focus on? What's an area of concern? And for me, it was here. Because I smile all the time, and I'm not going to stop smiling. So I noticed that my smile lines were getting a little bit deeper and taking on a life of their own, as I like to say. And that's where we started, and I think that's a really good starting point to say to yourself, okay, what is that area of concern? What are you focusing on when you look in the mirror? And that's what I learned from seeing you, Dr. Sykes, that it's those parts and those areas that you can focus on, and then you have the discussion about, okay, now where do we go from here?
Mm-hmm. Right. And I'd like to point out to people that, which something is already apparent to them, if they come in and they're focused on one thing, and I haven't dealt with that thing, even though I think they look better, they don't. So I have to make sure that I at least deal with that particular problem. Can we fix it or can't we? But at least we have to have a discussion. You know, if we can't exactly fix it the way I'd like to, whatever, or that it can't do it or don't want to do some of the things, then we have to deal with it in another way. There's actually more than one way to deal with some problems. And
well, I want to say that's what I love about you, is your honesty, your integrity, and your openness and honesty in discussing these things. This is critically important, and I have so much trust with Dr. Sykes, it makes me cry a little bit. But it is so important when you are talking about your face, a part of your body, this precious body and face that we have to take care of, that you are working with someone that you trust, someone who's very open and honest with you, if there is a result that you want to achieve. And Dr. Sykes says, you know what, I think this might be a better route to go. That's what I love about coming here. Because you're right, there is more than one way to get something done. And you are in this for the long term. Dr. Sykes, you are here. You have seen your patients for many years. You have had patients here. I've been coming here for a while because of that openness, the honesty, and the integrity that you have.
Well, thank you. Yeah, we do have a lot of repeat business, but you know, a lot of stuff we do is fillers, and I think fillers you have to repeat, but you don't want to repeat it ad nauseum and have too much, you know. And I think that I try to put the brakes on people sometimes. You know, let's do exactly what we need to do. You don't want to do more than what I need to do. People come in and say, I don't want my lips so big that they enter the room before I do, or I don't want, you know, I saw someone their cheeks are way too big, and I think that there's a tendency to have that happen. You have to be very careful, I think, with that. You know, most people that I talk to want to look like themselves, only better. They don't want to look like someone they don't really recognize in the mirror anymore. So I think that's really important. Let me talk a little bit about M-Sculpt, because I know that recently you had that. So this is, we're not in the face now. Now we're moving to the body.
Especially the tummy. So M-Sculpt Neo, you and I had discussed it and what it does, and I've been talking about it, and then I tried it. I came in and there's a room, it's very private, it's very relaxed, and it's a paddle and it goes on your tummy area, and you can feel this mechanism as it contracts your muscle, and it's really cool. And it does. I understand the science of it. So the science of it is that, or the abbreviated science of it is that it contracts your muscles to like 20,000.
20,000 times in half an hour.
Like 20,000 sit-ups. So I'm like, how is this possible? How is this going to work? And now I understand how it works, because you feel what's going on when it's on your tummy. And I just have it on my tummy, but there's other parts of the body that you can have it on.
Right. Well, it's core to floor, they said. So you can do stomach, you can do the legs all the way, calves, thighs, arms. So you can do basically your entire body. So I heard the door opening. We're going to have a little guest in a few minutes. So.
Oh, good. Hi, we have a guest. But, for M-Sculpt Neo, do you want to talk about the Mother's Day package now, or you want to wait for that? Because are you doing something special for M-Sculpt Neo? Or just...
We have an awesome package for M-Sculpt Neo, which I'm just going to say that. Right now, you need to call and ask about it, because it's a limited time, and it's really the best deal you're going to find in M-Sculpt Neo anywhere. So it's really an awesome thing to do. So please give us a call about that. It's going on for a bit longer, but you definitely need to call and ask about that. But it's a series of 4.
Yeah, so the series is the way to do it.
And it's once a week. And then many people actually come back and do touch-ups. So we have maintenance packages also. You can sign up for those, and you come back really at your leisure. You can come in a month, you can come in 3 months, you can come in 6 months, because the effect lasts maybe up to a year for the muscle. But obviously you want to maintain that yourself, or with the M-Sculpt. The fat that you lose, though, that 30% of fat you lose, that's going to happen every time you do it. So that's the great thing.
Oh, that's so nice. Yeah. That midsection, I know, that's been it's a family thing. Honestly, like, it's in my family. We have this little midsection thing going on. So for me, it also serves as a jumpstart to make you kind of aware of your core, and it kind of motivates you, like to take care of yourself in other ways as well. So M-Sculpt Neo, with the package now that you get when you call Dr. Sykes and ask about the package, it's also a really great idea for mom. With Mother's Day coming up, that could be a nice thing to do too. And it's, like I said, it's very private, it's relaxing, and with this series, you're going to see, a difference. It's just really something great.
No downtime, no surgery.
No downtime.
Doesn't hurt. It's amazing that it works, but it really does. It's an awesome thing. Let's see. Let's segue into some fillers, because our special guest that we also have, another guest, is Alicia.
Hi, Alicia.
Alicia, this is Angela.
Hi, so nice to meet you.
Angela, Legends Radio. And come on over.
Come on over.
We're going to stand and talk a little bit. And I think we're going to put you right in the middle here. There we go. So, and Angela, make sure
Sure.
you see it. So, I wanted to talk a little bit about fillers, because today our special is kind of about fillers. We have a special price. If you sign up from seeing this, then you're going to be getting one that you pay for, and one for 50% off.
Yep.
Anyone that signs up with our special today, some Mother's Day special for our fillers. And let's talk about how great the fillers are. So we were already mentioning it with Angela, what to do with fillers.
Okay.
You can do, cheeks, you can do nasolabial, you can do around your mouth. Mouth, it works really beautifully. That's the lips one there. And this one is basically for the rest of your face, or even off the face. There's other shows you can all off label, but they work very well.
Right.
And well, do you want to say something briefly?
Yeah, sure. Versa is unique in that it's 20% more in the syringe, so it's 1.2 mLs versus 1 ml in the other products on the market. Also, our product lasts 9 to 12 months. So it's a beautiful product. It's very versatile. That's why it's called Versa. And Dr. Sykes is great at injecting it. And it's just a very safe product. No report of a late onset granuloma since we launched this product. It's very safe. It's very smooth, and the results are beautiful.
Right. It's a hyaluronic acid.
Hyaluronic acid.
So there are numerous different hyaluronic acids out there. We have a lot of them here. This one I really like for a lot of different reasons. I love it in the lips. One of my favorite products in the lips.
Now, can anybody use this?
Sure.
To use this on anybody? Okay.
Men, women, obviously. Yeah. I would say 21.
Yeah.
Probably.
That's like, can I just ask about the men because we don't talk a lot about that on Legends. I mostly focus on women, but you do have patients who are men. And when it comes to men, what are you finding that they're wanting to do?
Well, a lot of times the men that come for fillers usually want to deal with this area,
Okay.
almost all the time. They, for some reason, with the beard and everything, they don't get the same kind of wrinkles we do. They don't get all those lines around the mouth. They're so lucky. They do tend to get, less hair on the top. A lot of times they'll have lines on their forehead, and they may be Botox candidates. So that's another thing we do. Sometimes we'll do filler in those areas on men, and that works actually pretty well and lasts a bit longer, or sometimes a combination of those two. But that's probably it. Men don't come in and ask for cheeks, although I have talked a few into that because they needed it. They didn't realize it. I think until we had products for it, none of us were really doing it, honestly. We could do a lift to kind of, improve the cheek area, but, when you realize there's volume loss and you can't fix that with tightening up the skin over it, right?
Right. So fillers. And there's different kinds. I mean, this is an example. When you come to see Dr. Sykes, like we did, we discussed what my options were, and that's your time to ask questions and understand. I didn't realize that fillers you can also use them here, right?
Temples, right?
Because this is an area where, as you age, or sage, as I like to call it, you got things start to happen. There's changes that occur in the face as aging happens, and that's why there's so many different types of fillers and great fillers like this one. So you can have that conversation about what areas you want to focus on, because it's kind of like a holistic approach. Sometimes it's not just one area. There's other areas too that are going to really make it. Make that one area look better too.
Right. Well, it's a balancing thing.
Yes.
Right. It's you're going from a rectangular shape as you're starting to get older. You want to go back to an oval. So you're trying to put some more of the emphasis back around your eyes and your cheekbones, and a lot of times the temples need to be fixed as well. So anyway, thank you so much. Let me just mention another thing we're doing here. Oops. Excuse me. Our next seminar is May the 24th, and we're talking about breasts that day. Augmentation, lift, reduction, taking out old implants, putting in new ones, or taking them out and just reshaping the tissues. That's kind of a lift as well. And then on June the 7th, we're talking about mini facelift, fillers, and eyelids. I think we didn't really talk on eyelids too much today. That's one of my favorite topics as well. And that's primarily surgery, but we can do things a lot of times around the eyes with different products, different techniques that we have. We have some non-surgical things for the eyelids, and all these are great things to talk about with your mom who might be interested in doing something. And Sue looks like she has a question, and I don't see anything.
Hi, Sue.
Hi.
That's
Well, I
Sue
just
back
wanted to
there.
remind everybody that our special of the month is 20% off all of our eye creams. So it's a
Oh,
great
very
time
nice.
to come out and
All right,
Visit
there you
with
go.
us.
The eyes have it. So
The eyes
that's what
have
we did
it.
talk about eyes now. But they're all really good. Our eye products are great. I personally have my own favorites. We have one that has a retin-A in it.
Mhm.
We have one that's good for pigmentation. We have some that are good for moisturizer. You can put all over your upper and lower lids. They're great products.
I just want to say too that I just had the most beautiful facial. I talked about this on the radio this morning, and I was really looking forward to coming here and getting this facial. And I feel so good when I come here, and I just want to thank you for all that you all do, because it makes a difference and it feels wonderful. So thank you for that. And that's a great idea for mom as well.
Yeah, you're absolutely right.
Beautiful, relaxing
And gift
facial.
certificates available. So your Mother's Day is coming right up, as you know. All right. Well, thank you so much. I loved having both of you here today.
Absolutely.
The double A's.
double
A's.
A.
A plus.
And thank you to your whole team and your whole wonderful staff. And I hope our Legends listeners, I know I appreciate you listening, and I appreciate you, being part of our lives. And I hope now you'll call Dr. Sykes and learn more in your journey towards more self-confidence.
All right. Bye. Thanks for tuning in.